when you are starting anything, in the beginning there are so many contradictions about what you are trying to do. And then a whole lot of time, people derail you by just being sometimes negative or sometimes positive. So we classify that as a storming phase. And in the beginning, I think the two first symposiums of AfriNIC were just about storming phase. Just people just wanting to understand exactly why do you have to do this, what are you trying to prove, and all that. But the third symposium in Zimbabwe, things started coming down. In Malawi, we knew exactly what we were trying to do and we were calm. But we were also very much aware of the things that are constraining us. It's going to be interesting to see what's going to happen in Ghana. And then keeping to the philosophies of the network, but open to new ideas. Like now, we are very much interested in linking with our international partners. Within the UNCRPD, there's an article saying we have to link with our international partners to actually foster that form of collaboration. So we are open in the network to new ideas, keeping the membership glued within AfriNIC. This is a network. If you don't feel like being part of AfriNIC, you just step out. You are not forced by anyone. So how do we keep the network glued together? Well, I can promise you there are about 500 people that are going in and out of the network, and that is fine. That's part of being a network. Allowing the conference to move to other regions of Africa and developing AfriNIC concept in other regions. I think other regions need to take this whole idea of AfriNIC and fly with it and develop disability research in their own countries. Developing research working groups in countries affiliated to AfriNIC. Now, I'll pause a little bit here and say this has been just a challenge for AfriNIC in terms of how do we develop clusters of researchers in countries so that countries can just get on with it in actually collating and developing disability research. And so we thought about it. Now you can imagine how long we have thought about this, because we thought about this in 2007, and it's part of the AfriNIC policy, but we're still thinking about it even today. So now we decided that, we are going to concentrate on the area of assistive technology or stroke assistive devices. We thought about that, I think that was in 2014. And then all of a sudden, new ideas around assistive technology, stroke assistive devices started coming up. Me linking with my colleagues, with the University of Washington, the GATE project. I don't know whether you have heard about the GATE project, but you'll hear more about it along the way. The GATE project, which is a WHO project, which is focusing on assistive devices. And then there's the Google project. And then we felt that maybe AfriNIC, in terms of research, we need to actually focus on the area of assistive devices / assistive technology. So that is going to be our build-up to Ghana in 2017. Ghana have also designed their logo for the conference, or their theme for the conference, that Ghana is focusing on inclusive education. So now they are saying for the conference, the theme is going to be, there could never be inclusive education without assistive devices. So they are branding that into the conference. So yes, and we are always plagued by not having money. It's our biggest headache. And also because we have got other academic demands, it's very difficult to really sit down and do a serious fundraising. So if we move from pillar to post, just trying to get funding. Then some questions arise whether AfriNIC is about research or is it about advocacy. I would answer and say it's actually about both. Yeah? And maybe some other time we can sit down and discuss that. And then, well, then when you start implementing something of this nature, there is a slow turnaround of situation. Then we are also not such a big unit, the size of the hosting mother. The Center for Rehabilitation Studies, much as maybe you might have a big mouth, but we are really not such a big unit. So in a way, we are always having constraint of resources. And because our university is actually on its own developmental journey around disability issues, internally sometimes we are not understood. We are just a network. Yeah. And what to from here? Well, we are going to prepare for the next conference in 2017. We are introducing the WHO Global Gate Project to AfriMid country working groups. We are working with partners in implementing that's not the Google project. We are going to strengthen the country working groups, the research country working groups. We'll start with the Southern African country working groups that when they enter the 2017 symposium, Musa, they must have their act together. So we want to actually go ahead and do that. We will strengthen affiliation with regional and international disability network as well as global organs such as WHO, UNESCO, and the UN. We'll continue marketing AfriMid widely. That's why I'm talking today at grassroots levels. And we'll try to, by all means, to generate funding. Yeah? So how do we link to the Google project? After my about almost everything, how do we narrow down to this project? Well, I'm here. You can see I'm actually the chair of AfriMid. I'm saying that proudly because we have managed to sustain this project since 2007. And when we enter Ghana, it will be 10 years, not like Safod, 30 years, 10 years. And we are actually proud of our 10 years because it being a network that is encased in the university is actually not easy to sustain, but we have managed to sustain it. So we will also work together with Safod, University of Washington, DEMAM, in terms of how we will map out this project and the development of tools. We will work together with some of my colleagues in the center where I work to develop tools for monitoring and evaluation and implement this process. We have been assigned by Google and our colleagues to actually be part of the development of the website. And we'll ensure the linking of the website with other websites that handle disability-related information. For example, Safod, the African Journal of Disability, AfriMid, Disability Alliance, Disability Forum, all those disability networks that really are out there. Then together with Safod, communicate the project to AfriMid stakeholders and other disability networks and disability researchers. With that, colleagues, I thank you.
Thanks again for having me and Mark from the University of Washington. It's been a wonderful experience so far. This is our first time to Botswana, and we were able to get out on some site visits yesterday, so we're just starting to explore. And we actually met Musa at the AfriMid event in Malawi, which was 2 years ago? Year and a half? Yeah. So it's amazing to see that this very beginning of an idea, the seed that we threw out there, and thought it was pretty unlikely that Google would actually call us back. But now we're here, and we had the wonderful official launch, so thanks again for having us. I'm going to actually be presenting on behalf of Damagi, who you'll all probably meet the project manager from Damagi. She'll be here sometime in May to begin their process, which will include interviewing all the different stakeholders that are going to be involved in the pilot. But she was not able to be here for this official launch. So her name is Rajmi Jagdish, and she's from the Cape Town office of Damagi. So I'm just going to go through and present on their organization and their technology, and hopefully give you a sense of how this is actually going to work. And then we'll feed into discussion. So I'll probably take about 15 minutes, and then we'll be ready with your questions for us. So Damagi's been around for 10 years. They're a social enterprise. They really have focused on hard-to-reach areas, so a lot of rural-based projects, and working in underinvested areas and underinvested users. So they really have perfected their technology to make sure that it is useful and compatible with rural communities. That includes people that are not familiar with using a lot of different high-tech technologies, that are possibly have different levels of education and language and literacy. So they've worked on a number of different projects to really try and refine their tools so that as many people as possible can use them, both in terms of entering information and in getting information from them. So they've had over 300 projects, as you can see, across the world, a lot in Southern Africa, also quite a few in India, and they've done projects for a number of different development organizations across all sectors. This is actually their first big project, or any project in the disability sector, so they're also learning quite a bit. They've mainly worked in health and infectious disease, maternal and child health, nutrition. They've even worked on some development projects in the agriculture sector. They have over 1 million forms have been submitted, and that simply means that their application, which is generally a phone-based platform, they're collecting information through those forms on the phone or the computer. And they also collect a lot of information through SMS. So you don't have to have a smartphone to use their system. So what they do, they take information that may not be very accessible or publicly available. So as you see here, there's just piles of papers in binders, and try and organize that information in a way that's more meaningful and more useful. So the way they do that is through recording, so trying to record all the information that's there, collecting from a number of different sources, aggregating that information, and also really trying to display it in a way that is meaningful for different audiences. So you can imagine, if you try and translate this into our project, you can imagine like maybe these are all records of types of wheelchairs that have been imported or distributed in Botswana, but nobody knows what's going on. Nobody has access to that information because this form of information is not very accessible to anybody. But if you can take that and put it on a system and make it more publicly available, then you have a number of different stakeholders, such as suppliers or people that are interested in getting involved in producing AT, that they can start seeing what's currently happening around wheelchairs in Botswana. And then you have the users that actually know where to find the wheelchairs. They also work on real-time systems, which is really about making sure the information is as current as possible. So as we said earlier, this isn't a research project where you come in and you just find out what's going on once, and then and then it's quickly out of date. Within a couple months or a year, things have changed. So it's really important to keep this system current so that people know exactly what assistive technology is available, how much is available today, not from last year. This is a visual diagram of how the system works. So on the left side, that's the community level. The blue person there would, in this picture, is maybe more like a community health worker, somebody who's a link between the community and service provision. In this case, it may be Safod or Bafod. That is really the connection. And then the connector is linked to the mobile technology. And again, this doesn't have to be a smartphone, it can be an SMS phone. But they're collecting information and providing information back to the community. And that information is stored on a cloud server, which is just a robust way to store information. And then it's displayed. So you can think of all the different ways that you can actually display that information visually or through descriptions. It doesn't have to be computer-based. It can also, and that's going to be another role of our organization, is figuring out how we're going to display this information and provide that information in multiple forms. As I said, you can collect the information and receive the information on different platforms. So on the far left, it's an SMS phone. The center is a feature phone, so it has a little more function, but it's still more basic than a smartphone. And then on the far right is the smartphone, where maybe you can be right online and being able to access all the information you need immediately. So as I said, it's really designed to work, to be compatible with different platforms, so technology can use this. One system they've developed is specifically for stock monitoring, and this may be the system that's most applicable in this project. It will obviously need to be modified, but it's mainly been used around tracking and stocking medicines. So it at least has begun, it's started to think through all the logistics of how do you track supply, how do you track actual commodities or products, know where they're at, know how much you have. So their stock monitoring projects they've run in a number of different countries, in Africa and in India. And as you see here, there's some that are designed more around family planning, others in agriculture, nutrition, and they've worked on also HIV and medications around HIV. So this is really where they're trying to track medications. A lot of these projects have been really focused on trying to monitor stock and notify decision makers of when stock is going to be empty so that they can keep a consistent stock and supply to meet their demand. So this is what it could look like on a phone. This is, say somebody entered in how much stock they had on hand. So they had 300 units of the oral rehydration salts. I had to look that up because I wasn't sure what ORS was. And 25 units of amoxicillin. So you see, it's a very simple system that you can enter in and say, this is how much I have on hand, and that information could then go to, whoever needed to go to in the system, if it was to a district manager or a hospital level, so that everybody knew how much was available. So how does this kind of stock monitoring system help? This is a map of, I did figure out which country it was. I think it's Tanzania. It was Tanzania. So this is a map where they've been able to identify where there's stockouts, where they don't have enough supply of a certain medication, and areas where they have sufficient stock. So again, this is a different project. We have very different type of commodities we're looking at here with assistive technology, but you can start to see how this can translate into this project. So you can, kind of imagine the map of Botswana and being able to point out different locations of where different types of AT is available or not available. That is also important to know. It also can serve as a communication system. So this is a message saying, hello, Maria Banda, do you still have crutches available? Please send your stock on hand, thank you. So maybe this is a communication that's going from, I don't know, an NGO to a clinic, and that may be one of the suppliers of crutches that is needing to know what they need at the clinic level or the community level. So there's that another way to have ongoing communication through this system. They found in one of their projects where they used the stock monitoring application in Malawi, that it really improved the stock reporting. So it was around 40% at baseline in some districts, and then consistently reached over 95% after implementing this system. The approach of Damagi really fits nicely with, I guess, the philosophy and how things have been naturally evolving so far with the team, is that they really design with partners. They've had enough history and probably enough failures in their beginning stages to realize that if you don't design a system to meet the user's needs, then nobody's going to use it, and it's not going to be sustainable. So their philosophy is to really do this whole beginning process, and you'll be part of that when Rajmi comes to Botswana, is to really get a sense of what information people really need day to day, what's going to be useful to them in a more immediate way, so that they actually have a motivation to use the system. So they're really comprehensive about making sure they know what's happening on the ground, and working with the people who are most connected and in Botswana, that's Safod and Safod, with all their networks and relationships that have been established. So they really have the right approach. They also focus on building capacity and local leadership. So Damagi will actually be working pretty intensely the first 2 years of the project, and then the third year there'll be more of providing consultation and technical assistance. And they will have to train George and other people within Safod or key stakeholders that are involved in how to use and how to modify the system. So it's not going to be something that they continually have to rely on Damagi for their expertise. That it's also a system that's designed for people to easily modify. So as needs change, or people realize that we actually really need to put more effort in this aspect of monitoring and not this, then you can make modifications to the system over time and make them fit different countries' needs. So this is the final slide. That's just a quick overview of the system that they're going to be modifying for this project. And when you think about just the opportunities for AT, the questions that this system can answer go back to our original aims are what AT is available, what types of AT are available, and where is it available. And think of how you can use this system on SMS phones or mobile phones, computers, or even call-in centers they've used in previous projects. If they found that it was just more effective to have one person, say, calling from Safod to collect the data and then enter it into the system. So I guess we can open it up for questions. Yeah. Thank you.
This is a terminal headache. But well, let me If you are hijacked most of the time, you hijack yourself if you go to the podium. I think I was very short. The shortest of what I've ever said in my life today. Let me say to all who are here that, you know, I take this forum as a very, very important forum that we should all have our commitment to, such that we actually realize the goals of this project. And, you know, I have an understanding that achieving this program would simply mean that we are improving the quality of life of our fellow colleagues, people with disability. And I would like to also talk to Safod that, you know, as if we were swimming in the same boat, without swimming a boat or whatever we do. You came at the right time with this project of the data issue. As data is usually a serious problem when it comes to people with disabilities. So to the government of Botswana, we are very excited once again that we've been the ones given the opportunity to pilot. And I think we'll be working close together to try and make sure that if there are any obstacles, they are actually removed for the paving way for this project. I would also want to thank AFRIN that, you know, research is one area that we sometimes take for granted. People think that they know everything. And why would you go all out to go and look for information that you have? But usually, research is not what people think. It is what you are getting from those who are concerned. So it's very, very important for us to be sharing a stage with a luminary of those data better, informing us of how we can actually network to try and put ourselves on the radar and form those committees that would enable the country to go on a massive strategy of researching. I would not forget our colleagues from as far as United States of America, that you are going to be running the shows, ensuring that the management of this project is done to the expectation of its goals and is done successfully. That you are also in touch with Google, the funders of this project, that I don't know how much